It's a pleasure to have you here. I'm Mark Lipsitch, the director of the Center for Communicable Disease Dynamics at Harvard School of Public Health, one of the MIDAS Centers of Excellence that's under the MIDAS program of the National Institute of General Medical Sciences. You'll meet people from many of the other groups that are part of that MIDAS network, and we're very pleased to have to welcome you today. First, the acting director of the National Institute of General Medical Sciences, Dr. Judith Greenberg.
Hi, good morning, everybody, and welcome to this very special workshop on infectious disease transmission dynamics. It's great to see all of you this morning, and I've already met a number of you at breakfast, and I must say I'm very impressed with your enthusiasm this early in the morning. I know some of you come from the West Coast and beyond. And I'm also very pleased that you learned about this conference in so many different ways. I understand that some of you heard about it at Abercams. I was at Abercams last fall and at SACNAS and through all kinds of other means. So it's terrific that you're watching out for things like this. Let me just tell you a little bit about the background of MIDAS. You're going to be meeting Dr. Irene Ekstrand a little bit later. She is a colleague of mine at the National Institute of General Medical Sciences, and about almost exactly 10 years ago, she and some other people at NIH realized that even though there was a lot of research going on infectious diseases, there really wasn't a good concerted effort being put toward modeling of infectious diseases. And she started MIDAS. I remember sitting in her office and coming up with a very clever name for, what does it stand for? Nobody even remembers. Modeling Infectious Disease Agent Study. But everybody knows it as MIDAS. So MIDAS was created to develop computer-based mathematical models to predict the spread of infectious diseases through populations. And you might remember back 10 years ago or so, there was the threat of anthrax and other potentially serious diseases that might be caused either through natural events or through terrorist activities. And so this gave some impetus to starting this. I think you can all appreciate the value. I mean, supposing you were the director of a public health department in a large city, and suddenly there's a breakout of a very dangerous kind of influenza. Or supposing a new type of flesh-eating bacteria that's antibiotic resistant starts to spread. What would you do? Well, you could draw on your experience or the expertise of some of your colleagues. But the group who organized MIDAS realized that a much better approach might be to have computational epidemiologists working on these problems and being able to then model on their computer what's happening and how they should respond, how many hospital beds they might need, whether to close schools, what other kinds of actions to take. So MIDAS turned out to be a group of scientists who are making these computer models and analytical tools a reality. They're creating computer models to study vaccination strategies for cholera in Haiti, examining the spread of influenza in college dorms, and figuring out how to reduce the impact of malaria and AIDS and tuberculosis in developing countries. And today, you're truly going to have a wonderful opportunity to meet some of these scientists who are using cutting-edge tools and modeling to understand the dynamics and the spread of these diseases. So let me just ask you, how many of you are planning on going to graduate school and getting a PhD? Terrific. Okay. Next question. How many of you really like math? All right, well, let me tell you something. I've been very involved over the last couple of years in developing a strategic plan for training for NIGMS, because NIGMS is very heavily involved in training at all levels, and we want to make sure that we're doing the best possible job that we can. And in the process of talking to lots of people who are involved in training, we hear the concern of, why are you training so many scientists? It's a tough job market out there. It's hard to get jobs. Well, let me tell you, that may be true, but the one area where jobs are available and where there seems to be a real crying need is for PhDs who have a really strong quantitative background, people who've had a lot of math training. This is true for doing biology, biomedical research across the spectrum, but particularly in areas like computational modeling, kinds of things that you're going to be hearing today, applied to epidemiology, to systems biology, which involves understanding the interactions between components in biological systems, functional genomics, trying to understand how genes work together to produce particular diseases or traits. All of these things, there's a huge demand for trained scientists. You've probably heard the term big data. That's new buzzword these days. It refers to data sets that are so large that they require new tools and analytic approaches to make sense of them. And by the time people your age get your PhDs, I am sure that there's going to be a huge need for scientists with computational training to address a lot of these big data-driven problems. So my message to you today is, first of all, to sit back and listen very, very carefully and learn a lot and ask a lot of questions. But I hope that it'll, if anything, increase your passion for science, and I hope encourage you to follow a route that's going to take you through some good solid math courses. Finally, let me thank Mark Lipsitch and the other organizers who brought you all together today. We're really very pleased and look forward to hearing some great talks. Thank you.